Good morning, grade 12s. Today we are speaking about something called lifestyle diseases. Apart from the fact that this is part of your life orientation curriculum, I would like to emphasize the importance of this topic. It is important for you to be aware of this matter for the sake of your own personal well-being. Every one of us is at risk of developing any of these illnesses. Knowing the truth about these illnesses is the key to living a healthy life and keeping yourself safe. What exactly is a lifestyle disease? This term refers to a number of illnesses that a person can develop, specifically as a result of the way in which they live. Lifestyle diseases are in fact the world's leading cause of death. All of us have a higher chance of dying as a result of illnesses that are brought about by unhealthy living than anything else. This is why it is so important to know the truth about these diseases. There are a few key things that a person can do to significantly lower their risk. A person should eat a healthy and balanced diet. A person should keep themselves physically fit. A person should avoid unhealthy or risky lifestyle choices such as smoking, drinking alcohol, recreational drug use, and also unhealthy sexual behavior. Finally, a person can prevent many potential serious illnesses by going for regular health screenings. Cancer. Cancers are a range of diseases in which abnormal, uncontrollable cell growth takes place. Cancer can be beaten with early treatment. It is therefore advisable that people go for regular health screenings or checkups. Cervical cancer. Cervical cancer is almost always caused by the human papillomavirus, commonly referred to as HPV. HPV is a sexually transmitted illness that often goes undetected and can be very easily spread. The virus can be treated with medication and it is not likely to result in serious consequences if treated. The threat, however, is in the fact that the virus often goes undetected. It can therefore cause more serious complications such as cervical cancer, which could even lead to death. Apart from practicing healthy sexual behavior, women can keep themselves safe by doing the following. 1. Going for regular checkups with a gynecologist. Once a woman or girl becomes sexually active, she can significantly lower the risk of cervical cancer with an early diagnosis of HPV. By having regular checkups, any potential dangers or other infections can be treated before they pose any serious risks to your health. 2. A vaccine is available that significantly reduces a woman's chance of developing HPV. It is advisable for all women to have this vaccine before they become sexually active. Skin cancer. Skin cancer is most often caused by excessive sunburn. A person can lower the risk of developing skin cancer by 1. Keeping out of the sun, where possible. Wearing protective clothing and hats. Applying and reapplying high SPF sunscreens. Getting unusual skin conditions monitored can stop cancer early. Lung cancer. Lung cancer is most often caused by smoking, or living in severely polluted conditions. Female smokers have a higher risk of developing lung cancer than men do. Lung cancer in particular is a very difficult form of cancer to treat and it spreads easily to other parts of the body and other major organs. Prostate cancer. Prostate cancer develops in the male prostate gland. Symptoms of prostate cancer include delayed urination, urinary leaks, blood found in one's urine or in semen, pain in the lower back and pelvic bones. It is advisable for men to go for regular screenings from the age of 40 years of age to detect any risks early, so that cancer can be avoided. Hypertension, commonly referred to as high blood pressure. Hypertension is a disease where your blood pressure in your arteries is constantly too high. This creates extra pressure on the heart to pump blood and can lead to various heart diseases, heart attack or even a stroke. Heart and circulatory diseases. Coronary heart disease refers to narrowing of the blood vessels, which reduces oxygen supply to the heart. This can lead to heart attack. The World Health Organization warns that heart and circulatory diseases are the leading global cause of death, with 30% of deaths happening as a result of heart and circulatory illness. Sugar diabetes. Sugar diabetes can occur in two ways. 1. A person can be born with diabetes. 2. Diabetes can develop later in life as a result of unhealthy eating habits. When a person has diabetes, their body develops some form of insulin resistance. The body does not produce enough insulin. Without sufficient insulin, sugar does not get into the body's cells and instead builds up in the blood. This can lead to body damage, such as damage to the nerves and small blood vessels of the eyes, kidneys, and heart. It can cause hardening of the arteries, which can then cause heart attacks and strokes. A person can suffer from severe dehydration as a result in increased urination. Some people even end up having diabetic comas, which can be life-threatening. Sexually transmitted illnesses. Multiple sexually transmitted illnesses can develop as a result of unhealthy sexual activity, such as HIV/AIDS, chlamydia, HPV or genital warts, hepatitis B, and syphilis. Practice healthy sexual activity by a. Abstaining from sexual activity until you are married. B. Being faithful to one's sexual partner. C. Condom usage can lower one's risk. Tuberculosis. Tuberculosis is an important consideration in our context, because the illness is a leading cause of death in South Africa, particularly among the poor. The illness is spread through airborne infectious droplets, most commonly via sneezing and coughing. Tuberculosis most commonly develops as a form of lung disease. The disease is particularly dangerous for people with immune disorders such as those living with HIV/AIDS. Those who live in poverty have a higher risk of developing lifestyle disease because they cannot afford to eat a nutritious and healthy diet. They have limited access to health information, which could help them to make healthy choices and prevent lifestyle diseases. They have limited access to health care. People who live in poverty are less likely to see and develop relationships with health professionals that can help them to identify their personal risk factors in order to keep themselves safe. They often live in overcrowded spaces where it is difficult to distance from others who are sick. Informal settlements don't always have satisfactory sanitation or garbage removal. This creates the perfect environment for germs and communicable diseases to spread. Gender inequality may place women at a higher risk of developing lifestyle diseases because men often make health choices on behalf of women. In certain circumstances, women do not seek health advice or go to see the doctor, because they live their lives completely in the control of the men around them. This means that they are less likely to have an early diagnosis or recognize risks. They therefore are not likely to make healthier life choices or receive any treatment that could significantly lower their risks. Women who live in these circumstances are also less likely to have access to information that will help them to make healthy life choices. Women often have limited power when it comes to sexual health. In some cultures, women have no option to choose the circumstances under which sex will happen. This means that they live with a much higher risk of developing sexually transmitted illnesses.